we saw that in US study, the incremental cost per QALY was about $10,000 per QALY, about 5,000 euros in France, and about $2,000 per QALY in Canada. So even if these studies use different methods, even if they use different assumptions, they are very consistent in terms of cost effectiveness of the ATIV. So next step will be to understand what is the impact at the population level, because what we have seen until now is just the impact, the comparison between vaccines. And if we say ATIV is the preferred one, we must see which is the impact in terms of financial burden to the system if we decide to introduce ATIV at a higher percentage. This is just, I show you very quickly some results of the budget impact model, where basically we compare a scenario with the current use of vaccines in Italy with a possible scenario with increased use of ATIV. Is it more costly for the system? Is it less costly to the system? We are not talking about effectiveness now. Just look at the budget impact. Consider the full Italian population. These are the percentage of coverage at the current, in the current scenario. So the majority of people in Italy are taking, at the moment, the TIV, even if they are high risk. So we want to compare this with a scenario where all the high-risk people are taking the ATIV. And I can tell you that if we shift all this population from a TIV to a ATIV, of course there is an increased cost associated to this vaccine, but there is a strong decrease of cost related to the other three vaccines. And overall, we estimated that there were some savings for the Italian system of about 1.6 million, which will be like very good savings, not only related to the cost of the vaccine, but above all related to the reduction of complications, especially respiratory complications. So our conclusion that we could have savings using more the adjuvanted TIV for Italy.
Marco, thank you very much. On that point there, you said about the savings that you weren't even looking at the wider economic benefit there. So your data there is specifically measured costs that have actually been saved.
The last slide that I show is just based on cost. So we are just talking about direct costs. So this total amount is based on total cost of the vaccine minus the cost of minus the savings of complications avoided. So, and we are talking only about elderly here. So about the population. Here we're not talking about productivity costs, for example, which is something can have an impact, but more for younger population, and we are not talking about effectiveness. While when we look at the results of the cost effectiveness model, we had both cost and effectiveness. So we had the QALYs as a measure of effectiveness.
Thank you. Well, do come back and join us here. Do anybody else want to come in? Before I throw it out to the wider questions, there's a lot in there about the actual economic impact and the cost effectiveness for these enhanced vaccines for the elderly. Anything, Paul, did you want to, you're nodding there, you pick up on a point there.
I've always believed that the data used by governments to make a decision whether to fund a vaccine or not is very restrictive. And certainly those people who work in the vaccine field feel hard done by the fact that we go through this process and cancer drugs and others are funded at $13,000 a week and so on. One of the things that I think is most important, and it was raised to some extent by Janet McElhaney yesterday, and that's the impact on the overall community of having more effective vaccines. She was talking about the decrease in antimicrobial resistance if we use better vaccines or if we're using more vaccine. Australia's going through the worst influenza season it's ever seen this year. And the preliminary figures just from the month of August suggested that it's been a cost of $90 million in lost productivity, just people staying home from work, people needing to stay home because their children are sick and so on. And they never make it into these discussions about enhanced vaccines or cost effectiveness of vaccination. I think that's disappointing. You know, there are broader issues at stake in making sure that we reduce the amount of influenza in the community. And the reality in Australia is that, and in many other countries, that 65 used to be the time that everybody put the feet up and relied on the younger people who unfortunately didn't get born in great enough numbers now to look for the rest of it. I mean, you have to work to 70 now in Australia before you get it. And there are a lot of people who are working well past 65. And so, productivity issue is not just young people getting sick and not working. So I think everything that's presented about vaccination cost effectiveness is a minimalist model because there are much more impacts in the broader community and the overall costs that are important in deciding whether we should do something.
Yeah, and we can see in the literature that when vaccination are considered from the national health service perspective, we often see just cost-effective results. But when we use the societal perspective, as you say, we introduce the productivity cost. Most of the studies show the vaccines are dominant, so they are not just more effective, but they lead us to, they can make savings to the system.
Correct.
And what is particular from my point of view for the influenza vaccine, that also savings are immediate, are in 1 year. Because very often we study vaccines where you have savings in 12, 20 years because you vaccine at 12 years. Let's suppose the HPV vaccination, you do it when you are an adolescent, you can have benefits in 30 years. While for influenza vaccine, you immediately have savings for the system. So it makes sense in some way to consider this kind of cost in the analysis. I haven't done this year because the study was, when it's commissioned by the NHS, they want to see the NHS costs. But if you do a full research, you should include also societal cost. But we have to say that for the elderly, this is not such an important issue just because we're talking about most of them are retired. But if we consider that at the, as you say, community level, that's a fundamental issue.
Thanks. And George, I think you want to come in there.
Yes, I really wanted to emphasize the cost to the families. And when the families cannot go to work, the cost to the industry. And of course, we talk about the health system and the cost there. The retired people don't actually put their feet up, and they work for charities. They do a lot of unpaid work that if they're not actually there, we have to have somebody else whom we pay to actually do it. So there's a lot of things that JCVI, NICE, and mathematical modeling do not take into consideration, and for us are extremely important. Yeah.